Hi, this is Dr. Nate Upshaw. I'm the medical director at NeuroSpa, and welcome to our first live YouTube chat here. So this is the first time that we've tried to do something like this, but we're really trying to respond to a need for our patients and also the community right now to try to get some information out there about mental health awareness, especially with everything that's going on with the COVID-19 situation. Let me introduce myself a little bit in case you don't know who I am or you haven't been to one of our clinics. I'm Dr. Upshaw. I'm a psychiatrist, and I'm the medical director at NeuroSpa, which is a TMS clinic. TMS, we treat people with TMS stands for transcranial magnetic stimulation, but basically it uses magnetic pulses to treat depression. So that's what we do at our clinic, but I'm also a general psychiatrist. I still see patients for other reasons. I have a lot of experience treating patients in the hospital, outpatient clinics. And so really this is a time where myself and my colleagues really feel like the mental health professionals need to kind of be out front and talking a little bit about what people may be going through with this COVID-19 pandemic, which obviously none of us have experienced anything like this in our lifetimes. And to be honest with you, I've been monitoring the situation really closely. Obviously, I'm a medical doctor, so I'm kind of up to date on the illness itself and the medical consequences of that, and which changes really on a daily basis, our knowledge about that. But also kind of I've been in tune with how people are responding to this, both with the patients that I'm seeing in the clinics, but also people that I'm talking to kind of socially, and also monitoring social media and kind of the regular mainstream news media to kind of get a sense of things. And I'll tell you, the kind of mental state of everyone has just fluctuated so much on a day by day and a week by week basis. If you just think back to where we were a couple weeks ago and where we are now, it's just mind blowing how much has changed just with our daily life and what we're doing, and also kind of how we're thinking about everything. And I think a lot of people are kind of on edge because of all of the changes and kind of also the uncertainty about what's going to happen, both from a medical standpoint, our health, but also economic consequences, family dynamics. It's just so much stuff to unpack with everything that we're going through. I'd like to kind of start by first talking about, some very specific things that I've noticed patients dealing with. I've had patients who still have their job. I have patients who've lost their job. I've had patients who are social distancing by themselves. I have patients who are social distancing with their families. And it just seems to be, no matter what people are going through and how different their situation is, it really just seems like this kind of overwhelming kind of background anxiety is kind of pervading everyone, kind of what they're thinking. So I'd like to talk a little bit about my situation. Obviously, I'm following the social distancing protocol. I'm a medical doctor, so we're still going into our TMS clinics and treating patients. We're following all the protocols in terms of making sure that clinics are clean and sanitary, and we've disinfected everything, and also social distancing in our clinics. But it's been on my mind as well. In the back of my mind, the risks of getting this illness. And, I'm a medical doctor. I have read all about this. I understand the science behind it, but still I fluctuate from day to day on my concerns about this and kind of fears about what could happen. So I'm going to talk about some more things. Like I said, this is my first YouTube live here, and NeuroSpa YouTube live, and we want to get to some questions too if anyone has questions, but also want to get information out about the mental health consequences of the COVID-19. I'm asking a question of my director here, so bear with me. Okay, perfect. So the other thing that I've been noticing a lot is people kind of unsure about the social distancing protocols and what that means for connecting with other people. I talked to a patient today actually who had a lot of problems in the past that she had kind of overcome, but this social distancing had kind of brought up some feelings in her that had reminded her of some other things that she'd been through, and that can kind of trigger mental health problems that you've had in the past. And that's an important point. So mental health problems tend to be episodic, and if you're struggling with depression or anxiety and you get treatment and you're feeling better, then you kind of feel like, okay, I got this. I'm on the right track now. And then something can come along and just kind of knock you out of sync, and then there you are back again. And so the important thing to remember is that if you've struggled with something before, that if you get knocked for a loop with something like this, that it's important to go seek help again. Hopefully, if you've gotten help in the past, you're still connected to your therapist or your psychiatrist that you've gotten help with. At our TMS clinic, we're available for people who to call in and get a consultation, kind of give us the information about what they're going through, and then we can kind of help them decide what the right treatment is for them. We have a question here. First question we have is, kind of explaining a little bit more about what treatment we do at NeuroSpa. So we specialize in TMS treatment. And what that does is that targets specific areas of the brain that are kind of out of sync. And it's FDA cleared for depression, but it can help with other mental health problems as well. And what TMS can do is, after a few sessions, can kind of get your brain back into sync again. It's covered by all insurance plans. And it is FDA cleared. So our clinic really specializes in TMS because TMS has been FDA cleared since 2008. It's been covered by every major medical insurance policy for 3 years, but not enough people know about TMS, and that it's a great alternative for people struggling with depression or anxiety related to depression who haven't done well with medications or psychotherapy. And so that's what we specialize in at NeuroSpa. And in terms of how it's applicable to what's going on right now, it's really changing on a daily basis. And so what we're finding is that a lot of people who are in treatment, and so people who go through the series of TMS, they end up usually getting about 36 treatments over a few weeks. And so the first thing people were worried about is that our clinic was going to close and they weren't going to be able to finish their TMS treatment, which luckily that's not what happened, and we were able to stay open. And I can talk a little bit more about that. But then what's happening is there's a lot of people who have found themselves feeling worse because of all of this, and now they're kind of contacting us to see if TMS treatment is something that could help them. So okay, this is a great question that kind of leads me back to what I was talking about our clinic staying open during this time. And so I'm a member of the Clinical TMS Society, which is the national and international organization of TMS providers. And I was able to attend a grand rounds a couple weeks ago where we talked about TMS clinics and what we can do to ensure the safety of the patients and the employees and the staff who come to the clinics. And one big point that was raised is that there's a risk of not treating depression. So the patients who are coming to see us, or the patients who potentially need to come see us, if they're not getting their depression addressed, when depression gets worse, especially with social isolating and stress of perhaps losing your job, it can lead to a lot of dysfunction that takes a while to recover from, and sometimes can even lead to suicidal thoughts at the worst case scenario. So it's important that we continue to offer this treatment if we can do so safely. The other point is that the TMS clinics, the chair, especially in our clinics, is in a private room, and patients are able to come in through the clinic and maintain that 6 feet of social distancing to sit into the chair, which has been cleaned in between patients. And the technicians are able to place the magnet next to the patient's head without touching the patient. And so it really minimizes any contact that you have with the patients and with the patients have with us or with the clinic itself. And so what I like to tell people is that obviously, leaving the house and being out and about at this time always carries some amount of risk, but it's my belief that in our clinics, you're safer coming through our clinics than you are going to the grocery store, where you don't know who and what you're going to be coming in contact with. Also, what we've done is we've implemented a screening tool that we just developed today that we're going to start on Monday. We're able to screen out people who may have been sick or exposed to someone who's tested positive for COVID-19 or perhaps is waiting for a test result of COVID-19. So really our intent is our clinic for all employees and the patients coming through that there is no positive case that we're aware of, and to minimize the risk of contacting someone who may be yet to turn positive in terms of symptoms. So okay, and so that's kind of what we're doing in our clinic, and we are following, especially me, I've been following the CDC recommendations, which really are changing on a weekly basis. And one thing that they've considered doing is recommending just on a daily basis that people consider wearing a mask. And so that may be something that we're doing in our clinic starting next week, where all people who are coming through the clinic, or all the employees who are going to be interacting with patients, may be wearing a mask to reduce the chance of any type of exchange of the virus, because I'm sure you guys all know everything about this at this point, but that this virus sometimes can be transmitted. We don't fully understand this, but can be transmitted prior to someone becoming symptomatic. So the thought is that when two people interact, if one of the people is wearing a mask, it's unlikely that if someone is contagious prior to becoming symptomatic. Obviously, if the patient was symptomatic or tested positive for COVID-19, they wouldn't be coming to the clinic, or the employee wouldn't be coming to the clinic. And so if you're wearing a mask, if the treater's wearing the mask, then they would minimize any chance of spreading if someone was asymptomatic. So I'm getting another question, so I'm going to read it out loud for everyone. So the question is, I'm not going through my mental health treatment as I should because of the quarantine. Is it safe to go to work if I don't go through my depression treatment? So that's a good question, and really any question that I get on this forum, I'm going to kind of answer in a general way, because without obviously knowing the specifics of your case, I can't give a personal recommendation. But in general, it brings up a good point, which is that if you're going to be going to work, then you need to be thinking about doing the things that maintain your health, like getting good sleep, making sure you're getting good nutrition, and if doing some type of mental health treatment like psychotherapy or taking your medications is something that you're doing, you should definitely continue to do that. Same thing with the TMS. I'll tell you, we have, over probably 50 or 60 patients in treatment right now. And I would say the vast majority, I've pretty much spoken to all of them at this point, but the vast majority of them are wanting to stay in TMS and continue with their treatment because it's helping them. And they feel like this is the last time, or the worst time, that they would want to be stopping treatment. And so, yes, I would say it's definitely important to maintain whatever treatment that you're getting for your mental health. So I'm getting another question here. No, that's not another question. Oh, so just to clarify, we're not just obviously disinfecting the treatment room. We're disinfecting the entire clinic when people come through, including the doorknobs when people open and close the clinic doors. And if you're worried about this stuff, you can feel free to wear gloves and masks to the clinic. And this is going to be an interesting cultural phenomenon, in my opinion. I think we're already starting to see it. When this first started, the COVID-19 outbreak first started, what you would see is people who were wearing a face mask or gloves, people would look at them and kind of be concerned, oh, is this person sick, or someone they're close to sick? But at this point, it's going to end up being the general recommendation that wearing gloves and a mask is good to prevent you from getting the infection, and especially since there can be asymptomatic transmission with this, if perhaps you were infected and asymptomatic, passing it to other people. So I think we're going to start to see people wearing gloves and a mask, and I don't think that that's going to cause as much anxiety for us, and I think it's actually going to make us feel possibly safer. So where someone might have been hesitant to wear a mask and a glove to the clinic, it actually could be a prudent thing to do at this point. So we have another question from David here, and the question is, I'm going to read it out. What kind of results do you typically see from TMS therapy? So our clinics follow kind of the national averages here, which is that pretty much anyone who shows up to TMS is usually going through their insurance, which means they've tried some medications and perhaps psychotherapy prior to coming to us. It hasn't worked for their depression. Of those people, we have about 75% of people that get, some response to the treatment. In other words, what I like to tell people is when they go through the treatment and they finish, they're pretty happy with how it turned out. They're happy they went through the treatment. They're usually on a little bit less medication or off their medications. And you've got a 50% chance of going into full remission, meaning that you're feeling really good. Your symptoms are essentially gone. And most people who have this type of response feel better than they have in a really long time. And so obviously that's the result we're always shooting for with everyone. But those are kind of the outcomes you could expect if you go to TMS. All right. And the other great thing about TMS is there's really no side effects as opposed to medication. And so this is really the exciting thing about TMS to those of us who have done a lot of this, and I've been doing this since 2010, is that since it's such a targeted treatment and the treatment itself is so benign, basically it's just magnetic pulses that are targeting one area of the brain. There's really no side effects like you get with medication, because medication, you're basically hitting the entire brain, and also you get effects in the body as well. So I have a question from my director, a question real quick, bear with me. So, hey, if you guys are watching this, feel free to like this and like our YouTube channel. Again, we're just starting this out, and really our big goal with this is just to try to reach as many people as possible. For right now, we're trying to do videos to educate people about mental health and to be available to answer questions about mental health during the COVID outbreak. But really, one of the big missions that we have as an organization at NeuroSpa is to really try to get the word out about TMS. There are so many people who are still taking antidepressant medications that are not effective or causing side effects, and they would be qualified through their insurance to get TMS, but they just don't know about it. And so that's the big thing for us, is to try to educate as many people as we can about TMS so that they know that it's another option for depression. So I was just writing my director a question real quick. I have a question from Hillary, which is, how do I find out if my insurance covers TMS? That's a great question, because I was just saying, there's a lot of people out there who are on medications who may benefit from TMS, and their insurance might cover TMS. You can just call our clinic, which I think we have a number down there on the bottom of the screen. But you can also Google NeuroSpa TMS, and you can go to our website and find out some more information about that. But one of the big things that we want to try to do with NeuroSpa is increase access for people to come in and get TMS, because again, it is a treatment that in my mind is safer and potentially more effective than a prescription of Prozac. So think how easy it is to get a prescription of Prozac. You can go to a nurse practitioner, you can go to your doctor, you can go to a walk-in clinic, you can go anywhere and get a prescription of Prozac. That's how easy it should be for people to get TMS. That's really what we're trying to do. And so, you know, when Hillary asked, how do I find out if insurance is covered, we're trying to make it so easy that you can just call us or go to our website. You can just give us your insurance information, a little bit of history about you, and we can tell you, you know, right away if you're covered by insurance, how much you'd have to pay out of pocket. We want to make it as easy as possible for people to get TMS. I had one of our really great success stories just write a message saying thank you, and that TMS has worked really great for her. I won't say her name on air per se, because she's kind of identified herself as saying that TMS worked great for her, but she was a really great success story. She really stuck with it and had a lot of obstacles, especially early on, but she has just done amazing with the treatment. So, you know, thanks for watching. I have a question here. Trying to catch up. We're getting a couple questions now. This is great. This is from Ursula. I work for an insurance company, and I have been sending them to you guys. So I guess that's patients to us. Yeah, you know, and this is really one of the interesting things about TMS is that, you know, I'm a psychiatrist and I have colleagues who are psychiatrists, I have colleagues who are medical doctors, and the medical system really doesn't know what to do with this treatment yet in terms of when to refer people. So, you know, you ask most doctors about TMS and they'll tell you, hey, yeah, I know about TMS and it works for some people, but you know, they don't exactly know. If you ask them, when do you refer someone to TMS? They couldn't really answer that question for you, which is, again, one of the reasons we constructed this company the way it is. We're trying to reach directly out to people, because what we found is that, you know, the kind of the medical system is still following the insurance's lead, where you have to, you know, try a few medications before you get the treatment. And again, like I've told you guys, I think that this treatment really belongs kind of out in front of medication trials. So you try one medication, if it doesn't work or gives you side effects, you should be able to get TMS second. And that's really what the consensus is from the TMS Society, and it's also the consensus from the clinical trials. The people who were originally studied in this in the clinical trials for this treatment had only tried one medication, and then they got TMS second. So that's really where this belongs. So another question from it says, Solly, does Medicare cover TMS? Absolutely. Medicare, if you've tried a few medications and you've tried psychotherapy, Medicare covers without a prior authorization. So all we have to do is get some information from you, kind of verify the medications you've been on, and Medicare does cover TMS. This treatment typically works pretty well for people who qualify for Medicare, which are usually, you know, people who are over 65, or else some other people have a disability also sometimes have Medicare. But it typically works pretty well, because medications, as you get older, some people don't know this, but medications cross the blood-brain barrier a little bit easier. So medications that, you know, for someone who's younger are great, can actually cause side effects for people who are older. And so medications can be a little dicier with older population. In fact, I'm not sure how many of you guys have heard of ECT, electroconvulsive therapy. Is still a very go-to treatment for older individuals because of side effects of medications. Obviously, TMS is completely different than ECT. ECT treats by putting electricity into the brain and causing a seizure. TMS, there's no electricity going to the brain, so TMS is completely different. But it's a great option for older people who are not doing well with medications. James asked, where are you located? Well, I'm currently located in my house, but I'm sure you're asking where the clinics are. So we have one in Citrus Park near the Citrus Park Mall on Gun Highway. We have one in Pinellas County on Park Boulevard. And we have one in Lakeland on South Florida, right across the street from the Lake Miriam Publix. And then we have one in South Tampa, which is across the street from the West Shore Mall. So David is asking, I was told that you need to have 3 medications. Any wiggle room on that? I've had brain injuries. So TMS typically works well for anyone who has kind of I will say like an atypical brain, right? So someone who's had a brain injury or someone who's had some other stuff going on in their brain. Typically, we find as psychiatrists, they're more sensitive, to the side effects of medications. And TMS, since it's such a targeted treatment, tends to be a better treatment for people who have had issues with their brain. I've treated quite a few people who met criteria for major depressive disorder. They had a history of some brain injuries in the past, and they did much better with TMS than medications. There's a question from Leandro. Does TMS hurt? So when you read the kind of fine print about TMS, it'll say that it can cause a headache. But what happened is when they first started TMS and did the trials, they had to start people on the full dose. And so the only thing you can actually feel with TMS is there's the magnet actually sounds like an MRI machine, and there's a tapping feeling that comes from the magnet. And what that is the electricity is going through the magnet to generate the magnetic field. Again, there's no electricity going into your head, but there's electricity going through the magnet to generate the magnetic field. And how you generate the magnetic field is you change the polarity of the electricity quickly, which causes kind of a snap. And that causes the magnet to kind of give a sensation of a tap. And that's also the clicking sound you'll hear with an MRI magnet. So once someone starts TMS, we start them at a low dose, and that is not painful at all. And as we work up to a higher dose, we do so in a way that doesn't cause pain. So this is one of the interesting things about TMS. The treatment is considered so benign that when we train on the machines, we actually practice on each other. So I have had TMS treatment before. I've tried pretty much all of the manufacturers of the different machines, so I know exactly what it feels like, and I can tell you it doesn't hurt. And I start patients out at a low dose, and so I probably do 5-10 mappings a week, which is a new start, and everyone tolerates the treatment really well. I tell people not to be nervous at all. There's no pain. There's no nothing to be worried about. It's worse to get your blood drawn or to go on a roller coaster. So there's another question from Leandro, which is asking if TMS could help with depression brought on by this COVID epidemic. And so this is going to be the interesting thing to me as we go forward, is what is going to happen to the mental health of people in 3 weeks, in 6 weeks, and we don't know. There's just no precedent of us as a society going through something like this. And so, the other mental health professionals I've talked to, we are just sitting here waiting to see what happens. Hopefully, we come through this well, people are able to get back to work. The things that the government's doing to try to mitigate the effects of shutting down the economy are going to come through, and people are going to be okay. But I have concerns about the subtle effects that can happen from some of the social distancing and some of kind of the trauma of living life a certain way and then changing to the way that we're doing things now. So reading another question here, sorry. So here's another question. So do you focus the magnets according to the diagnosis, or do you follow brain scans? And if so, would you need a brain scan would you need brain scans that show brain activity. So this is a great question, which kind of brings us back to how this TMS thing started. So I'm not sure how many of you guys listening, if you're patients of mine, you might have heard me tell this story before, but basically the technology behind TMS was invented in 1985. And the psychiatrist who thought about putting this technology to the brain to treat depression, Mark George, kind of thought about this in the late 90s as we were getting functional MRIs. And so we were actually able to see with functional MRIs that the brain activity of someone who's suffering from a clinical depression is different than someone who is having kind of normal brain activity or is not depressed. And so what we find is there's a specific spot in the brain called the dorsolateral prefrontal cortex, which hooks into this larger circuit that's out of sync with depression. And we can access that in the surface of the brain with this magnet. We can treat it, and it syncs up the whole system. And so we know that that is the spot to treat for most people who are suffering depression. That was what the clinical trials are based on. So we do not need an MRI in order to know where to treat for each patient who's suffering from depression. So there is some work going on in academic institutes to find out if, those few people who don't respond to TMS, do they have something a little bit different going on with their circuitry, and could we identify that on a brain scan and tweak their treatment a little bit? So that's something that we're looking for in the future. But for no, you don't need to get an MRI. If you're suffering from a clinical depression, we already know what spot to treat. We know exactly what to do to try to help you, so you don't have to do that. So I'm getting quite a few more questions here. Let me see if I can kind of catch up. Ursula asked, do you treat anxiety or depression more? Would it work if you have panic attacks and really bad anxiety more than depression? So depression and anxiety are very closely related. When people benefit from TMS, usually their depression and their anxiety get better. Right now, it's FDA cleared for depression. There's a certain protocol we use for depression. And again, most of our patients who get benefit also get benefit from depression. There's a few off-label protocols that we've had a ton of success with at NeuroSpa for treating anxiety. And it's actually kind of focused on the same spot in the brain, but there's a little bit different frequency we use that's pretty anxiolytic, meaning it treats anxiety a little bit better. But a lot of our patients with panic attacks, they do improve, and so we would expect anxiety and depression to improve with TMS treatment. Rachel says, can younger patients like my kids receive treatment? Right now, this is FDA cleared. I believe the original studies were done on 22-year-olds, so I think the technical FDA clearance is like 22. I'm not 100% sure off the top of my head on that, but insurances now are covering this pretty much 18 and up. Obviously, this technology is very safe. There's not been any significant toxicity identified with it, so there's no reason to think that it wouldn't be safe in children and adolescents, and that's become kind of standard of care among child and adolescent psychiatrists. A lot of them feel quite comfortable treating children and adolescents with TMS. There are some clinical trials going on right now. So much like the COVID-19 situation with these medications that we're looking at to see if they're safe and effective, we can see that it's safe and effective. We think that it's safe and effective, but until we get larger clinical trials completed, there's not going to be an FDA clearance for children and adolescents. So if you do have someone who's under 18 who you think may benefit from TMS, I still recommend that you reach out to us, because we have treated patients younger than 18 on a case-by-case basis, depending on what the situation is. I have a question from Terry saying, I'm having fear and anxiety over what is going on. What can I do? So I think the best thing that I've given people advice on this is to kind of take a step back and see what's going on in terms of, do you have a history of dealing with this anxiety or depression? If so, does this feel the same? Does it feel different? And try to reach out to get some professional help if you're concerned that something serious is going on. If you feel like this is something you've experienced before, or you feel like that nothing serious is going on, serious I define as, you're not able to sleep at all, you're constantly distressed, maybe even having suicidal thoughts, you should definitely reach out to professional help. if you're just stressed because of what's going on, a couple of key things that you can do. First of all, you can try to disconnect from the social media and media in general. You should try to hook in every day to make sure you know what's going on, but they are going to be sharing the worst case scenario and the worst things that are going on. So you have to remember that what they're estimating is that worst case scenario, there's, maybe 100,000 people pass away and maybe couple million people infected, which is terrible and is something we need to try to prevent. But with that being said, I think if you end up watching 6 hours of news, you might think that there's a 99% chance you're going to get this and an 80% chance you're going to die. And so, disconnecting that, plugging back into reality, you have to kind of make sure that you keep a routine. You have to make sure you stay connected with people who you love and you care about. And you have to try to distract yourself if you're getting really anxious and wrapped up about this. Turn the TV off, turn the social media off, watch a movie, connect with other people, go take a walk outside, make sure you're staying 6 feet away from other people. But that's kind of the advice I've been giving my patients. I've gotten a lot of questions here. I'm trying to catch back up. I'm not sure. I'm trying to ask my director. Because we had a few questions go by. Here's one I can see. Christina, I have a family member who's struggling. What is the best way for me to introduce this option to them? That's a great question. So the first thing I do, because obviously I talk to a lot of people who've never heard of TMS who are coming to see me, or I'm speaking to people in a group. I always like to start if they've heard about it at all, right? So if they haven't heard about it at all, or even if they've heard about it a little bit, I like to remind everyone that this is a mainstream treatment for depression. And so it's covered by every major insurance carrier, including Medicare, and it's been FDA cleared since 2008. And so Medicare does not cover stuff unless there is a ton of data showing that it's both safe and effective. So although they may not have heard about it before, their friend may not have heard about it, the medical community considers this a mainstream treatment. And so it is both safe and effective. I also tell people that the technology's been out since 1985, and there's never been any evidence that this does anything to the brain other than restore healthy, normal brain functioning. So people don't get tumors from this. They don't get brain damage from this. It doesn't warp their mind. It doesn't cause memory problems. It's a very benign treatment. And again, I remind people, this is considered so, safe amongst medical practitioners who've been doing this for years that when we go to conferences, we actually test this out on each other. To see what does the machine feel like, what does the patient feel like. And I'll tell you, when a new psychiatric medication comes out, I don't try it to see how it makes me feel, because there are subtle risks with the medication. And so when a new TMS machine comes out, I'll sit in it and see, how does this one feel? How does it work? And so that's kind of some suggestions I would say. I would also tell them to go to our website, NeuroSpaTMS.com. We have tried our best to try to present this in a way that people can get educated and understand that this treatment is safe and effective, and is something they should try if they're struggling with depression or having side effects of their medications. Okay, so I think we have some more questions. I think we have a few more minutes on this. I want to see if the director here can send me the questions. Yes, okay. So thanks everyone for being so active on the questions. I actually do have 5 more questions in the queue here. So Lauren asked, how often will you be doing these live YouTubes? So we're considering, depending on how this one goes today, I don't think it's gone too terrible. I think we're going to try to be doing these once a week, because again, just with our own patients, we've had at this point, hundreds and hundreds of patients come through our TMS clinic, and we want to be available to people who've had success with TMS and maybe have questions about this. We want to be able to answer their questions, but also we want to get the word out there to other people and be available to kind of talk people through this. Again, talking with my colleagues, we're not emergency room doctors. I'm a psychiatrist. I'm not going to be going and intubating anyone. I'm not going to be, saving anyone's life with a respirator. But all of us doctors feel like, really everyone at a time of crisis like this feels like they want to chip in their own way. And, for us, this is kind of something we're trying to do to help out in our own way, to see if anyone has questions that we can answer about mental health and COVID, and, other questions about COVID as well. Because again, I'm a medical doctor. I do have some information about, COVID itself. So this is from Terry. Oh wait, so there's a question that so I think we answered that question. So let me make sure there's not anyone else who asked a question that wasn't answered. Oh, no, I think we're good. So I'm going to go ahead and just wrap things up here. Hopefully people who've watched this have gotten a little bit of benefit from this. Feel free to let other people know who can log in. I think we're really going to try to do this once a week and kind of get the word out there. And again, I'm a board certified psychiatrist. I can answer any question that you have about mental health in general. I've worked in the inpatient hospital, outpatient clinics. I have specialty training in psychotherapy. I'm an expert in TMS. I've done ECT. So anyone who has a question for psychiatrists, we're here to help. All the info is here on our website, and feel free to call us and let us know if you have any other questions. So thanks again for joining, everyone, and we'll see you next time. All right, take care.